You and I both see a lot of chronic pain patients, and a lot of them don't even put two and two together that their food is causing a lot of this issue.
If you're drinking something with sucralose or Splenda, and you're getting chlorinated water from your tap, or if you've got heavy metals, it's blocking your ability to make that active thyroid hormone from T4 or synthroid.
Welcome to the Taylor Method for Pain-Free Living podcast. This is part two of my series with Elizabeth Tringali. Go back to part one for all the other stuff, that amazing information she shared. We just are making this a two-part series by going on to the next. We're just going to keep on rolling in regards to our conversation. Elizabeth, welcome to the show again.
Thank you
Even
for
though
having
we're
me.
just continuing from our previous conversation just recently. And I have more questions for you, but I really wanted to get on the topic of chronic pain. It's such a topic that is so prevalent here with people, but I do have a few more questions that people ask. We share a lot of the same patients, and so they're asking me questions, and I'm deferring all these now to you because you're just such an expert on them. Let's talk about the topic of thyroid and Hashimoto's, and you probably see a lot of thyroid cases in your office. Can you talk about it for a little bit?
Oh, yes. There is a lot of thyroid everywhere. It's a pandemic. And again, the standard tests when you have your physical at incredible places like the Cleveland Clinic, you just do a TSH. That's it. The thyroid stimulating hormone. And I did that for years when I was doing primary care. That's all you look at. If the TSH is normal, there's nothing wrong with your thyroid. So there's, again, an epidemic of subclinical hypothyroidism. And that's where it looks like your thyroid's working well on the surface if you're just doing a basic test. But if there's like 7 other tests that we do that are abnormal, we're missing it. Or you might just have the symptoms. You're freezing all the time. You're losing the lateral aspect of your thyroid. Your hair is really thin, constipated, your skin's dry, your elbows are dry, all those lovely things that go with thyroid. So we do a workup through your insurance. All those tests are covered by LabCorp and Quest, and we'll check the antibodies. And it's way more than half the time you'll have a normal thyroid TSH, thyroid stimulating hormone, but you have the beginning of Hashimoto's. And when people go back to their endocrinologist, they'll say, yeah, but we don't check that until that TSH is elevated. So again, in functional medicine, we're trying to prevent you from having to go on those meds and treat it ahead of time. So with Hashimoto's, it's an autoimmune disease. It starts in the gut. It's triggered by things like mold. So if you have your house, you have water damage, or a lot of people don't even have water damage in their house. They just have something wrong with the vents, with the intake, and there's like, mildew or something up in the vents. But mold is a big trigger. Heavy metals. Florida is full of fish. Everyone's eating fish, right? Pescatarians, I see them all the time. The fish has mercury, and I love fish, so it's not like I'm anti-fish, but you have to be careful. And people say, well, I eat wild fish, and that's the kind of fish I recommend, wild fish. But the industrial waste is at an all-time high. The ocean's polluted. And so the mercury content in the ocean is so high that the fish are being poisoned. So if it's a fish more than 10 pounds, it's going to have high mercury. And if you genetically can't clear that mercury because you have an MTHFR or methylation defect or something, or you don't make enough glutathione, whatever your mutations are, you're going to have an accumulation of this metal, which affects the thyroid and all the hormones, obviously. But so again, we're getting back to the cause of Hashimoto's. So mercury, mold, gluten. And this country, when you go to Europe, you can eat gluten, you can have bread and pasta, and people don't have the same issues that they have here. We have, because of farming and to double the crop yields, we've changed our wheat in this country. And now there's 5 times more gluten. It might be 4 times, but there's 4 to 5 times more gluten protein in the wheat than there was when you and I were little kids in the 70s and 80s.
Mhm.
And it is very inflammatory to the gut. The body can't process it. The root word of gluten is glue. It's inflammatory, but it causes this whole autoimmune cascade in the gut to attack the thyroid. So with Hashimoto's, you always have to look at gluten, mold, and mercury. Those are the big things. Now, there's other infections like Clostridia, I think CMV, Epstein-Barr. There's other viruses that also are linked with Hashimoto's. So we'll do that workup to see. And then you don't have to go right on a drug. After cleaning up the gut, those antibodies go down. And if you talk to your endocrinologist, they'll say, no, just go on Synthroid, suppress the immune system, by suppress the thyroid, and then suppress the attack on the thyroid by going on this synthetic drug. But again, if you change that microbiome, those antibodies go down, and I like to modulate it with peptides. We talked about this briefly. So my favorite peptides for autoimmune disease are thymosin beta, thymosin alpha, and BPC. Now I'm getting a little bit more into something called LL37. So these peptides can actually modulate your immune system and make it work again, so it's not attacking your body thinking this thyroid organ is gluten or something else, because the body's confused and it's starting to attack something that is ours. So once you do that, the Hashimoto's gets better. And of course, look at the environment, look at what are they drinking? What are they eating? Is there mold in their house? That kind of thing. But it's a pandemic of Hashimoto's. I see it all the time, every day. I had it briefly in 2016 and I got rid of it. And it was a lot of gut work. But once I cleaned up my gut, the antibodies went away, and I still had to take thyroid medicine, unfortunately, but I don't have the autoimmune attack.
Do you find that, or when somebody they come to you, they're on Synthroid, right? They still have they have Hashimoto's,
Yeah.
and they're given Synthroid. The doctor thinks that that's going to resolve their. What do you do with patients that are on Synthroid? Do you help them wean off of it? Do they have to take it the rest of their life while they're taking natural medicine with you? I mean, what's your opinion and thoughts on Synthroid with Hashimoto's?
I don't mind it, but there is gluten in Synthroid, so I prefer Tirosint if I have to use a drug.
Okay.
You have to be careful with the glandulars and Hashimoto's, so like Armour, NP, Nature Throid, West Throid. And there is research on this. I wasn't like really sure when I first read it, but it's like, okay, there's definitely truth to it. Those are glandulars, so the immune system can attack that as well, and it could make your antibodies go up. But once I see their free T3 or their T3 total, like their active form of thyroid, and balance that, they don't need as much of the synthetic Synthroid. And there was a time I was getting people off and I was using bioidentical thyroid, but Synthroid is bioidentical. It is bioidentical T4. It just has a bunch of filler that we don't like, which is why I like Tirosint, because it doesn't have any of the filler, and Tirosint is covered by insurance.
Okay.
But what I found, the bioidentical T4, it didn't seem to work as well. People were still cold and constipated, and I would combine it with T3, which is the active form of thyroid. So you should be able to convert Synthroid or T4 into T3. But if you're low in selenium, zinc, copper, iodine, magnesium, B vitamins, or if you're drinking something with sucralose or Splenda, and you're getting chlorinated water from your tap, or if you've got heavy metals, it's blocking your ability to make that active thyroid hormone from T4 or Synthroid. So we give people the precursor so they can convert, then we can get them on lower doses of Synthroid, and then we'll try supplements if they're not, they're not so far gone. Like I was far gone by the time I figured mine out. So I can't really get off. And I tried getting off of the thyroid medicine. It was like a handful of vitamins, an additional to all my vitamins I had taken. It was just easier for me to take Armour Thyroid, honestly. But you can get them on a lower dose. And I find as I get people, if they're overweight, which generally when you have hypothyroidism, you are overweight generally because it controls your metabolism. So as I get the weight off, optimize their conversion of T4 to T3, then their dose of Synthroid's lower. And I am successful getting people off, but that's usually if you're on a Synthroid 50 or 75 or 25. Once they're at 100, that's been suppressing the thyroid for a long time, atrophying the thyroid. It's hard to get them back from 100, though you can get them from 100 microgram dose to maybe a 50, and then maybe go on something a little bit more clean or bioidentical. But it's definitely treatable.
What's your opinion on, there's a big movement where people are using sourdough bread to negate the gluten, including our family. We've been doing that recently. So what are your thoughts about sourdough that's been fermented, and as far as to take care of the gluten issue with regular flour? What are your thoughts?
It is lower gluten, but it still has gluten. Now, I would assume in your family, you look really healthy to me. Your skin looks great. Your hair looks great. Like you can tell you're well nourished. You can see like your muscle mass, everything looks healthy. So if you don't have a gluten issue, it's probably okay. But in general, it doesn't really negate the effect. The sourdough, you are getting fermented foods, which I like, but if you have SIBO, so most of the population has a small intestinal bacterial overgrowth. So if they have this infection in their gut, the sourdough may make it worse. And because of molecular mimicry, you're still getting that gluten, and that still can trigger an autoimmune attack. So I don't recommend that in my patients unless I do food allergy testing. And when I do a food allergy test, it's not just allergies, it's allergies, sensitivities, immunoglobulins, and I'm checking C3D and C3B, which is like a complement and immune response to the food. So if those are all clear, and you know the sourdough doesn't bother you, and you don't have autoimmune, then if I say, okay, you can have it. It's
Mhm.
organic, making it yourself, right? But the stars don't usually align for the patients I
Mm.
see, but you're not a typical patient I see because you're so
Right.
healthy.
Yeah. Yeah. Okay, well, this is what I really been wanting to get to here. I just, you've been so fascinating asking these other questions, but I really would like to, for this show, to focus on the topic of chronic pain. And you and I both see a lot of chronic pain patients, and a lot of them don't even put two and two together that their food is causing a lot of this issue. So talk about what you do for patients with chronic pain and how you help them using functional medicine.
So the chronic pain patient, we start with the gut, put them on the elimination diet. We do food allergy testing. We take out gluten immediately. Gluten is extremely inflammatory and does make cytokines, like it makes inflammatory markers. And then we look at their drugs. If they're on a statin, I'll say for 30 days, I'm taking you off your statin. I'll give them some other herbs to lower their cholesterol because I don't have all the information at that point. And then I will use different herbs to help the inflammation that's systemic. Like I use turmeric, boswellia, um, fish oil, SPMs. I love SPMs. Do you use SPMs? They're
No, I
really,
don't. Mm-mm.
it's like this protein in fish oil that's anti-inflammatory, but it's amazing. So we're looking at the systemic inflammation, right? Not
Mhm.
just like, oh, I've got arthritis in my hands. So I'm looking at what is causing the
Yeah.
inflammation in your hands, right? And it's usually diet, but it's drugs, diet, deficiencies. Um, and the home, again, it comes into that home. Mold will cause inflammation. It increases something called TGF beta 1, which is a cytokine, which causes pain and infections. I will see a lot of different bacterial infections in the gut that are triggering pain. So once I eliminate the poison foods, get them on some basic herbs, change the bacteria in their gut, and then get them on peptides again. I love my peptides. The BPC 157 is like the most incredible peptide I think that was made. It's over the counter. It's 15 amino acids, and it tells the brain not to feel the pain. It makes you heal. So once I work on the whole system, it seems like that pain goes away. And then, of course, I'll refer to a chiropractor because if there is a herniated disc, I can do all these wonderful things, but they're still going to have, that feeling of pain down there. So they might need an adjustment, or they might need to get on the PEMF, the pulse electromagnetic frequency. But if you work on the gut, you're working on the whole system, and you check the environment and what you're putting in, that pain will definitely go down. And I
Mhm.
know myself, when I cheat, like, if I cheat on my diet, like if I just
Oh, yeah.
eat,
Sure.
I pay for it for days. My
Right. Yeah.
knuckles, you can probably see, like they swell, like when I cheat, they swell. So I definitely get arthritis in my hands. And for me, it's pretty cool to see, like, oh, I ate that, and look, now I'm paying for it.
Hmm. Yes. I mean, your body it'll talk to you, right, in different ways. And we just have to get better at paying attention to these signals that the body's giving, letting us know that, hey, I didn't like what you fed me the other night, or I didn't like this, or what you did with this. And so the better we can get at that, the healthier and the less pain we'll have. Chronic fatigue syndrome, is that something you probably see quite a bit as well, correct? And
Right.
that's tied in with the pain. Same cause, gut issues, correct?
Mm-hmm.
Stress, toxins.
And a lot of viruses with chronic fatigue, and it's a mitochondrial disease. So we work on things to reboot the mitochondria, so alpha lipoic acid, CoQ10, your minerals, of course, the MitoPure, I like peptides. There's a peptide called MOTS-C, and it makes you make energy. Methylene blue, which you and I were talking about the other day, getting in a red light booth, or, even just going for a walk outside, and then
Mhm.
fasting, intermittent fasting, that helps autophagy, right? So that's going to help your chronic fatigue. But people with chronic fatigue are so used to having to eat all the time to get their energy, so if I can balance their adrenals, kind of balance their hormones, get them nourished again, their fatigue is better. And that's probably when I have to use the peptides and the IVs, because generally when I see them for chronic fatigue, they've had it for like a decade.
Right. Your IVs that you use, tell us about the different IVs that you use to help patients get their health back.
We have so many, you have to come down for one.
Yeah, I will have to do that sometime. Yes.
So all of our IVs are preservative free. We make them fresh for each patient. I have worked at IV clinics where they would make them up earlier in the day and let them sit there all day, but you're losing the nutrient value because it's just because the light, even if you haven't covered it, the light denatures it. So you have to be careful, like when you go to a clinic that has them pre-made or has preservatives. The last thing I want to do is I'm detoxing you and then I'm putting preservatives in you. It doesn't make sense. So they're hand tailored for each patient, made fresh. We have all these different add-ons like piggybacks. So like the basic IV that everyone seems to know is the Myers cocktail. You probably have heard of that from John Myers. He made it for chronic fatigue years ago, and it's minerals, C, B, magnesium. So you can piggyback onto that other things to help your body detox better or to give you energy. So my favorite piggyback on that is alpha lipoic acid, which is excellent for insulin resistance, but it's good for the nerves, good for the central nervous system. It's good for longevity, but like numbness and tingling, chronic fatigue, heavy metal detox. So I pretty much can't go wrong with that basic combo. If you come in, you don't know what's wrong with you, you just want like a little pick me up, I'll do the Myers ALA, and then I'll add on like a CoQ10 little shot in the tush to help the mitochondria. Glutathione I love, but you have to be careful with that because some people don't tolerate glutathione well. Do you know about glutathione? It's actually a peptide. It's 3 different aminos, but it helps detox things like mercury. And it's important for every single cell to detox poisons. Women really need it for detoxing estrogen. We use it a lot in MS for the brain. I think Dr. Perlmutter made it famous using it for MS. He was reversing, oh no, actually I lied, that's Parkinson's. Dr. Perlmutter was doing videos, you can probably find them on YouTube, where he would give an IV drip of 2,000 milligrams of glutathione, this antioxidant, and he'd show a guy shuffling with Parkinson's, and then he'd get the IV and he'd walk perfectly normal. So it's affecting the whole nervous system. It's amazing. So that's a great little IV, and it's inexpensive. It's like, if you just did that IV alone, it's $90. So it's not like a terribly expensive thing. Like you could save up and do something like that. And then for the heart, we do chelation. So that's an amino acid called EDTA that helps basically pull lead out of the system, but also pulls plaque and calcium out of the arteries, but you have to be on minerals for that one. Phosphatidylcholine, which repairs every single cell membrane in the body. That helps the cells talk to each other with communication. So I do that IV as well. I have a sport IV for athletes, but I'll use that even for people with like fibromyalgia. So it's for athletes because it's got ornithine, which is really good for recovery, and glutamine and arginine and citrulline, which are great for nitric oxide and circulation and blood flow. But when you have a fibromyalgia patient, they're not moving, everything hurts. So if I can give those amino acids IV, like I really like that to wake everything up and nourish those muscles that are just kind of like pain, in pain all the time. And then with the sport IV, I'll piggyback that BPC 157, which again is 15 amino acids for healing. So it's sending signals to the brain to no matter what's wrong with you, it's going to make you heal. So everyone feels good on that little piggyback IV. Then I've got higher dose vitamin C drips, like the Immune IV, if you're feeling like run down, probably that's what your patient got that day. It's a 25 gram, so 25,000 milligrams of vitamin C in an IV. So why we like IVs, and I mentioned this before, it's bypassing the gut, it's going right in the bloodstream. I know you're absorbing 100%. I don't have to worry like what's going on in your gut. Can you get all that in you? And if you tried to do 25,000 milligrams of vitamin C orally, you'd be in the bathroom all day. Like you can't absorb it, you're gonna have diarrhea. And then we'll go up to like a 50 gram bag of C, and then we do ozone. So it's old school. So we take a little bit of your blood out, inject it with ozone, which immediately turns to oxygen. It oxygenates the blood. We put it back in. It helps circulation, blood flow, and makes everyone feel amazing. Recently, I just got into exosomes, which are purified amniotic fluid. What I like about these is it's, as Dr. put it this way, it was so elegant. He said it's like putting like a floppy disk into your hardware. So it's rebooting your hard drive by giving you messenger RNA from a baby without any DNA. There's no DNA, there's no cells in it. It's just purified amniotic fluid, these little exosomes or amniotic, these little vesicles. They're telling the body, hey, stop having pain, and it's instant for pain. So when you do these exosomes, I had back pain, and I was doing them for the very first time. This is like 2 years ago. And I didn't realize my back was even bothering me. It's like constantly 2 out of 3 of pain. It's not that bad. So I was doing the IV for something totally different. Oh, this for COVID. Anyway, and I got out of my chair and I'm like, oh my God, my back feels amazing. Instant. So instantly it's giving my body the signal to lower the cytokines, lower those inflammatory signals that are causing pain. And the effect can last up to 6 months. I think for me, maybe like 3 months. Sometimes I feel like, oh gosh, I got that IV last week and I'm already tired, again. But those are going to change the way we do medicine, and stem cells as well. If they we're looking into doing stem cells, which a lot of chiropractors are actually getting into. We have to graft a little bit of fat, not a lot, and then you use this machinery to siphon out the stem cells, and you inject your own stem cells into your body, and you get, like, again, an immediate response. Like, it just seems like this is how they're curing, heart disease or chronic fatigue, joint pain. You can inject those stem cells into your joint and actually regrow areas that are like torn. If you have a torn rotator cuff, they've got studies now where you inject the stem cells into it, it heals. Whereas before, all we had for a rotator cuff tear was surgery, right?
Yeah.
Not in your realm, but in our realm, like, that's it. Oh, you need surgery, it's torn. Even PRP wouldn't totally heal a tear. That's platelet-rich plasma, which we do as well. But now with stem cells and PRP, these orthopedic doctors that are doing it, they're healing joints. It's amazing.
You mentioned the other day, that was something that was new to me. You were talking about how we're talking about adhesive scar tissue and how it causes a lot of pain for different people. You were mentioning how microbes get enmeshed in them. Can you talk a little bit about that? How they're those little opportunistic creatures, how they attack that area? Talk about that in your experience. That was like,
yeah, they are opportunists, right?
right.
So we're not sterile, right? We're constantly dealing with infections in our body, and our immune system handles it. And when you have a damaged area, or like an area where there's not enough blood flow, like your neck, right, or your back, it's like tight and it's just not, which you use a laser to help the blood flow. They're finding in studies now the fascia that, like, kind of, it's not just, we used to think, we were taught in the 90s, it was just like this kind of wax papery type soft tissue that covered your organs and kind of kept everything in like a girdle. But now they're finding there's like this whole another organ that the fascia and the lymph are linked, and all these little critters, all these bacteria and bugs and stuff are getting caught in there, and they're causing more inflammations. That goes probably with the fibromyalgia patient. Their lymph is congested, and in the fascia are all these little bugs. So I remember at one of the Lyme conferences I went to, this lady who had extreme ear pain, didn't know why. And it was like, went to all these different doctors. Long story short, she biopsied her ear, and they found the spirochetes for Lyme in her ear, in the fascia, stuck in there. So I think it's great with what you do when you're lasering, and you're doing body work and yoga and anything to move, or sauna or infrared. Like, we have this ozone sauna I'll stick people in. I know I'm getting those little suckers because I'm heating them up. I'm putting oxygen in this tank. I'm using infrared, red light, and this frequency specific microcurrent that they're holding while they're in there to get the blood flow going. But people have stagnation, they have all those little critters stuck in there. Including me,
right?
all the time. So I'm not immune.
And I've seen this with people with migraines. I know that you have good success with migraines, and there is tissue, it's scar tissue, just in the muscles of the scalp and in the cranium and all. But can you talk a little bit about migraines, the success you've had migraines using your functional medicine approach?
Again, it all comes back down to the gut. And the air quality and what you're drinking. But migraines, 80% of them, you get them off gluten, dairy, eggs, soy, corn, and sugar. Give them a little magnesium, potassium, some electrolytes, some fish oils. I like those SPMs, a B complex, CoQ10, and a multi, and they go away. I remember years ago, a famous local doctor, Dr. Winter, called me up, and I was treating a patient of his, and the migraine was gone within a week, and the kid had intractable migraines. They wouldn't go away ever. Put him on the diet, put him on some basic vitamins, like 5 basic vitamins. He hadn't had a migraine. And so the doctor, the neurologist, genius neurologist, is like, what did you do? And I'm like, I just took him off these foods that we know are inflammatory. And it works. Now there's hormonal migraines too, but food does control hormones. So there is that. And so does insulin. So you again, working on the gut will help that. But sometimes women just need a little progesterone, and progesterone is over the counter. They sell it at Whole Foods. You just have to know how to dose it. But that also would help. But it seems like magnesium deficiency in this country is huge. Potassium deficiency. And again, standard of care, we check potassium in a chemistry when we do blood. It's like a $5 test. It's through insurance. It's going to be normal. You have to do a red blood cell potassium. The red blood cells hold potassium for 90 days. And same with magnesium. Your regular serum magnesium is going to be normal because your body keeps a homeostasis when you do testing. Like, it wants to not die. So it's going to steal from the tissues and cause inflammation elsewhere, so your heart and brain keep working. So that's called homeostasis, right? So we'll do a regular chemistry, your potassium, magnesium are fine. I'll do the red blood cell levels, and they're in the toilet. You give those vitamins, they feel better.
Right. Yeah. Fascinating. And again, this goes with all different types of symptoms, even weird ones like neuropathy. That's a mystery for conventional medicine. Now, I don't know if you've had patients with neuropathy, but a lot of that is due to function. It's a functional medicine issue for a lot of people, right? Have
Yes,
you had experience with neuropathy, treating patients with neuropathy?
absolutely. It's usually a B deficiency, magnesium, alpha lipoic acid, and then of course there's pinched nerves, so you need to get nutrition to that area sometimes. But like the alcoholic neuropathies that I treat, it's Bs, thiamine, B6, B12, folic acid. So we'll give them IVs or shots, and it will reverse it. Uh,
Diabetic neuropathy. What about with diabetic neuropathies?
Alpha lipoic acid is amazing for that, and magnesium, high doses. And
Then you
again,
have there's also chemo-induced neuropathy.
oh yeah, from chemotherapy, right?
Yes, that's a huge one
That
in
is,
office, yeah.
I haven't seen much of that, thank God. So you probably use shockwave for
Well,
that, right?
right, there's the shockwave and the laser is great for neuropathy and whatnot, but it can be tricky. And but there's the functional medicine component. What you do is, I think, the combination between the physical, using the like shockwave and laser and uh, other technologies, combined with what working on nutrition, it's just going to give their body the best chance for overcoming some of these weird conditions that conventional medicine has no answer for.
And they
Really,
tell me,
right?
and then they put them on a seizure medicine to tell their
Right.
brain not to feel pain in their feet.
Yes.
So I'm like,
Exactly.
that helps your pain, but it's not treating your problem.
As we close here, um, give give us some tips for lifestyle changes that our listeners can make, that the general advice you give for patients for just living and overall, avoiding a lot of the things that you're dealing with that you and I treat. So let's hear it as far as prevention and lifestyle changes that people need to make.
I think people need to pray and meditate. I think right now we're being inundated with politics and just all these terrible things that are going on in the world, and it's on every device we own. And I
Right.
think you have to ground yourself, So I'm a big Christian and believer that you have to pray, but if you believe in the universe or whatever else you believe in, center yourself, ground yourself, and meditate. Do something to get the internal chatter out. So I believe
Mhm.
that's number one. Number two, move. You got to move. Even if you have pain, see your chiropractor, see someone like me, but you got to do something for movement, just basic stretching, anything. So pray, move, eat clean. Go to your local farmers market. They generally have better prices and better quality fruits and vegetables. Try to eat real foods. Try to stay away from boxes and barcodes, so like anything packaged and processed. And then do yourself a favor and do like a little cleanse a couple times a year. No gluten, dairy, soy, corn, eggs, peanuts, sugar. Even if it's just a week, you will feel amazing. Oh, and alcohol, of course. So pray, move, do a little cleanse. Make sure you're drinking purified water. Do not drink the tap water, especially in Florida. And then make sure your environment is clean. Have your vents checked in Florida at least once a year, anywhere you live. But Florida is the tropics, and we have a lot of stuff in our vents. So
Mm.
have those vents clean. I think those are 5 really good basic things anyone can do, on any level.
Right. Great. Well, thank you so much. I know you're extremely busy, and you're a challenging one to get a hold of with your busy schedule. So we really appreciate you taking this time to spend sharing the wealth of information and knowledge that you've given to us. And we're really appreciative. Thank you so much. You're just a wealth of information. How can people get a hold of you if they want to book a consultation with you?
Well, first of all, I want to thank you for having me, and it's an honor working with you. So thank you. You can call my office at 561-283-1166. And then you can also go on my website, and you can put your information there and it'll go directly to my office. And so the website's Tringali, TRINGALI -health, HEALTH.com. And you can also go on my Instagram, which is just Tringali Health or at Tringali Health, and get all the information you need there. And I've got multiple practitioners, a physician, and I've got lots of people that can see you that I've trained, and I hope to see you soon.
Great. Well, you've been with Elizabeth Tringali, founder of Tringali Vibrant Health. It's been a great show. Thank you so much for your time. And again, if you've been dealing with some challenges, things that she's been talking about, and you have not been able to find answers, please give our office a call. You will not be disappointed. Thank you so much, Elizabeth, for your time, and we'll see you next time.
Thank you, doctor. Take care.
You've been listening to the Taylor Method for Pain-Free Living podcast. We hope that you found great value in this episode. For more information about the Taylor Method and our offices, visit www.drderektaylor.com. Make sure to tune in next week as Dr. Taylor will be providing more knowledge and resources about pain-free living.